Welcome to the Westside Barbell podcast. Today's guest is Dr. Shawn Bailey, and he is our team physician here at Westside Barbell. Shawn works alongside us to ensure our athletes have access to primary care, physical therapy, recovery aspects, and sports science testing with his very talented team at the Armory here in Columbus, Ohio. He is also a part of our board of advisors optimizing athletic health and performance with everyone who comes through Westside. I also wanted to bring Shawn on today to give you all a chance to get to know him better. We'll talk about who he is, how he operates, and his approach to internal medicine. Plus, we'll dive into some fundamental but vital aspects of athlete health. In future episodes, Shawn will join us to discuss specific athlete testing, treatments, and corrective measures, giving you all a deeper insight into what it takes to be a professional athlete. Through this and future podcasts, we aim to share what Westside Barbell is doing, where we are going, and keep you, our community, always informed and up to date. Staying true to the philosophy and methods of Louis, our athletes don't pay for training here. We cover their performance needs, including primary care, physical therapy, recovery, merchandise, etc. We do this so their success and our successes are tightly linked. It ensures that honest and factual information is shared between us at all times. This information helps our athletes make money through affiliate links as we share their training journey using the conjugate method through our blogs, our social media posts, and our podcasts. Before we continue, I'd like to take a moment to thank our sponsors. To support them, please check out the links in the description below. All right, let's get started, and I hope you enjoyed the episode. Welcome to the Westside Barbell podcast. Today's guest is Dr. Shawn Bailey. Shawn, appreciate you coming in today. I figured let's get started with your start. What was it that got you into healthcare and to become a doctor?
I realized at a pretty young age that I wanted to be a doctor. Middle school, early high school, it was like, what do you want to be when you grow up? I want to be a doctor, So like I kind of had that baseline, and I think it was a combination of being interested in science, being interested in the human body, but also the goal of helping others and just the enjoyment of helping others have a better quality of life.
Did you understand the model of healthcare you're getting into? And we were just talking before we started of there is such an initial negative connotation going to a doctor and getting treatment. Was that your introduction, or did you always have a vision of what we'll get into what you're doing now?
Well, I think anyone, when they first start med school, really even to residency, they have no idea what the healthcare system's like. You think, if I'm a doctor, I'll go and I'll be able to just help people, and it's this magical thing. Yeah. And when you get into it, you realize it's not at all what you thought it was going to be. So for me, that didn't really happen until third or fourth year of med school. Like first and second year of med school are just bookwork. You're learning stuff, memorizing huge volume of things and taking tests. And then somewhere in third or fourth year of med school, you go to the hospital, and then you go to some private offices and you see what it's actually like, and you get exposed to it. And I remember around that time frame having a massive, almost panic experience, because I quickly realized that being a doctor is not what I had it built up to be in my head. And there was a period of time there, third, fourth year med school, maybe even intern year of residency, where I said, I can't do this. I want out. This is terrible. By that point in time, you are so deep in financial debt from med school, you really don't have a choice, because you can't exactly go take a job with a lower salary and afford to pay that debt off. So you're kind of locked in. Yeah. So you're kind of forced to see it through. So then what happens with a lot of physicians is you get through your training and you go out and get that first job. And then you're kind of thinking, what is this? What are we doing? Like, am I really helping people or not? And so that was something I struggled with, big time, in that transitional period.
What's the volume of work like when you're going through college?
But when you go through, undergrad, the pressure is you have to have good grades, right? You have to have a certain GPA and you have to have the right extracurriculars and you have to do very well on the MCAT test. And if you do well, then, you get into med school pretty much. And you get to med school and, it is voluminous. All of a sudden, compared to my undergraduate was in electrical engineering, it was fairly challenging major. You get to med school and just the sheer volume, the sheer hours are a step up, quite a step up. But then when you get into the clinical care, it's really where the hours get crazy. And they really peak somewhere around intern year of residency. And I know during my intern year, there were weeks, I think my maximum hours worked during a week was somewhere around 113 hours. And it was very much like that. Since that time, they passed some rules and regulations where they can't work you more than 80 hours a week, although they're only loosely enforced.
Yeah.
But it might be something like an intern year during your worst week, you show up at the hospital 6 a.m., round on your patients, do a full day of work. Normally you go home around 6 p.m. Well, the night you're on call, you spend the night, so you spend the night and, work through the whole night for the most part. You don't get any sleep, maybe an hour if you're lucky. Then at 6 a.m., you start the next day. And then you work that day until maybe 6 p.m. So you've really been working about 36 hours straight, go home and sleep, and then you're back at it at 6 a.m., right? And you have to, you might have to take that call shift 2 to 3 nights a week. So it ends up being a lot of volume, a lot of hours with very little sleep to get through your training program until they say, hey, you did what you need to do. Here's your certificate. You get your medical license, you pass your boards, and you can say, I am now this specialty. And then you go set up shop and you go work.
Do they give you an education on the business side?
Zero. It's kind of interesting. The medical education program in the U.S., at least when I went through, and I don't think it's much better, is almost zero business, knowledge. Most physicians are not well equipped to go start their own practice. Almost everyone comes out, especially these days, and they're employed. And, there's usually some productivity bonus based on, how well you do, how much money you bring in for them, but that's about it. The other thing, if you start to look at things in the medical education that are quite shocking, you learn almost nothing about nutrition. You learn almost nothing about physical activity. You learn almost nothing about how to recover appropriately after physical activity, those type of things. You will know all of the details about the pathophysiology of medical conditions. They will teach you when a diabetic patient comes to your office or a person with high blood pressure or high cholesterol comes to your office, they will tell you exactly each medicine that you can use and how you prescribe that and how they interact and so on and so forth. But what is lacking is, most of those conditions are lifestyle, generated conditions, and they don't have to exist. If a person can change their lifestyle, change the way they're living, they can reverse those issues.
Yeah.
But the system, both the education and the way it's practiced in this country, there's very little effort spending to reversing those things. So it kind of leaves us with a healthcare system where instead of being proactive and preventative, it's more reactive. There's very little opportunity in this model to come in and say, hey, I'm now 50 years old. I found out I have diabetes. What can I do to make it go away so I don't have to spend the rest of my life taking medicines? So, and that sort of was one of the biggest frustrations for me. I got out in practice and I decided to start my own practice. And I went to my educational background was I went to Purdue University, had a degree in electrical engineering, graduated in 1997. Went to Ohio State for med school, finished up in 2001, and then did a 3-year internal medicine residency program at Riverside Methodist Hospital. Finished that out in 2004. So in 2004, my wife and I decided we're going to open a practice. And we bought a very small building and converted it to a medical office and set up shop. And at that point of time, it was just traditional insurance-based medicine. You have to see a patient in the office and you collect a copay and deliver the care the best you can. And if you're lucky, the insurance company will send you a reimbursement check in 30 or 45 days, and that's what you do.
Yeah.
So you get in that system and you realize that the volume of patients that you need to see on a day or in a week or in a month to keep the lights on, and to pay your employees and everything, it's a really high volume of people that you need to see to make that work. It's on average somewhere around 125 patients a week, 500 patients a month, which translates into about 25 patients a day. And if you figure you want to do it in an 8-hour workday, divide 8 by 25. It's almost a patient every 15 minutes. But that doesn't really include the time that you have to do all the charting afterwards, or call in prescriptions, or schedule tests, or review test results with them. So it ends up being that on average over the course of a month, you maybe have 8 or 10 minutes to sit in a room with a patient, on average. And frankly, it's just not enough time to deliver good patient care.
I think a lot of people assume when you have doctor, you have to know everything. Like every aspect of my life, you should probably know how to fix it.
Mm-hmm.
And what was strange working with athletes is we'd have athletes go to doctors and they had no idea how to deal with a healthy person.
Correct.
They had a very hard time, like, why are you here? And they're like, well, we want to stay healthy. And that's when we got introduced to you. And full disclosure, Shawn is our physician here for all our athletes and with Westside. And the one thing that struck me with you is you don't talk like a doctor. Like you talk like a regular person, and you talk with people, not down to people, to which you go to a visit, you go in, usually you're anxious because you don't want to be in a doctor's office.
Absolutely.
And then all you assume is just bad news.
Yeah.
This whole thing of thinking about preventative is completely new. But with the athletes, the only people I saw getting good healthcare were football players, because it was mandated with their contracts, and they were getting access to absolutely everything to prevent them, because they're obviously their big asset.
Absolutely.
So where did two questions. One, how did you learn to communicate? Or is that just a personal aspect of who you are? And two, when did the whole idea of, okay, I have to change what I'm doing and help more people?
I think it all flows together, right? And it's a process, and if you look at it, one of the problems is most physicians don't know how to relate to an athlete. A high percentage of physicians were not necessarily athletes themselves. A few were. A lot of physicians don't exercise regularly. And you combine that with a lack of good training. And the problem is when an athlete comes in, they don't know what questions to ask. They don't know how to respond, because it's foreign to them.
Mm-hmm.
And on top of that, there's a time barrier that they're feeling, and all of those things make it hard to deliver good care, whether it's an elite athlete or an emerging athlete or a regular person. I think sort of my evolution into working with athletes, it's been ongoing.
Mm-hmm.
I think it started with me personally, and I was an average athlete. And I was undersized. I was 5'11" and change. And when I graduated from high school, I weighed 135 pounds. I was very scrawny, and my athleticism was average. I enjoyed it and I did okay, but I wasn't going to, get a college scholarship. I started training with weights somewhere in high school, and it just took. It was one of those things where I loved it. I loved the process. And for me personally, it is my stress relief. Like going through residency, and when things were really stressful, I was able to go into the gym and lift those weights, and that's how I cleared my mind. And even those days where I only slept a few hours, I just told myself, I am not going to miss my workout, right? When you're in a residency program, you almost feel like an indentured servant, like they own you, And it was the one thing in my mind, they will not take that from me. I will always get my workout in. And as things have gotten stressful, that's how I kind of handled it. So for me, it was mentally therapeutic, right? But when I started seeing all patients, I started looking at each individual person as an athlete. And that could be a young person. It could be a 90-year-old person. It could be a 600-pound person. It could be a 50-year-old person with diabetes. They're all athletes. And what I mean by that is the same physiological principles apply to everyone. And that could be, you might be an Olympic gold medalist, the NBA MVP, right? But those physiological principles are the same. So, when people started coming in, I started to think, gosh, like 85% of what comes into a medical office that we treat in primary care is a lifestyle related thing. So 85% of the people, you can help them without medicines if you teach them to do what they need to do to live, right? Our bodies are an incredible complex machine. In my opinion, the human body is by far and away the most advanced, most complicated, most magnificent machine ever made. And what I mean by that is, well, for one thing, it heals itself, right? And you can treat it really, really badly for a long time, and it still will heal itself, unless you take it too far. And, when I started looking at, things as food as fuel, like if you put diesel fuel in a Ferrari one time, that car is permanently ruined, right? You and we could eat McDonald's for 3 decades, which is the equivalent in my mind of putting diesel fuel in your Ferrari. It'll still run. Maybe our bodies run maybe suboptimally, but then when you start to put the right fuel in, your body heals itself. So I thought that was magnificent. Yeah. So it started with the concept of developing a system where everyone can improve their life through proper nutrition, proper exercise, body composition changes, all of those kind of things, proper, healing from injuries. So it started seeing that, but then the model also works really, really well for athletes, so I almost look at as when you look at it, you alluded to this, like an NFL team. An NFL team maybe has more financial resources than any other sport, perhaps. And like you said, those players are to some extent assets, right? They invested a lot of money in those players, so they have a lot of motivation to keep them on the field. They want them to have a nice long career and to be effective and miss time off. So that's, the impetus for figuring out how to eat and train and recover and all of that. Well, we can look to that model and scale it down to anyone, average people all the way to emerging athletes and to, other elite athletes who maybe aren't in a sport that generates the revenue that the NFL does. So that was kind of the pivot, looking at everyone that way. Now, kind of back to your original question was working with an athlete, so a lot of times, I've seen this happen time and time again in my office. An athlete comes in, and maybe this might be a 21-year-old college kid, who's not playing a sport, but just wants to look more jacked, for example. Or it could be someone else, they come in and they have a question that when they've asked a physician before, they did not have a good response. And I'll give you an example. Someone comes and says, "Hey doc, like I'm kind of scared. I've been taking this performance enhancing substance. Maybe it's a SARM, maybe it's Tren, who knows? Maybe it's testosterone." And they're like, "Hey, I did this and I'm scared about this," right? So a lot of physicians, first of all, they don't even know what those things are, right? And their first response is, "Why the hell would you do that? Don't ever do that again and get out of my office," right? Well, that was very unuseful for that athlete. They don't know what to do with that, right? So for me, I think it's just sitting down and saying, "Hey, like what's going on in your life? What is your goal? What are you trying to accomplish? And is that, why you're choosing to do that particular behavior," right? And then once you break it down from that, you can sort of help them design a pathway to achieve their goal while minimizing the health risks that they're taking to get to that said goal. So really, I think what it comes down to for me, when anyone walks in my office, but especially when an athlete walks in, starting the conversation with something along the lines of, maybe not phrased this way, but why are you here? What prompted you to come in? right? What's on your mind? What is your concern, right? And then also, what is your goal with your health, with your wellness, with your sport now, and also ultimately? And once you have that framework, and you understand what their fears are, then you can start to talk like friends, talk like a coach, and develop a plan to help them achieve their goals and achieve optimal health and wellness along the way.
What age, ideally, would you want to see someone who is an emerging athlete going into a pro?
I think as young as possible, right? Because the things that you need to do to be an athlete, you need to learn, right? It's not intrinsically obvious. And there are certain things that everyone's associates with being an athlete. Maybe the biggest is having the right skills for your sport, skill development. It takes time in practice and muscle memory and all these kind of things. And then perhaps the next thing people think about is, being strong enough, being big enough, being fast enough to do those things, right? Like those are pretty more intrinsically obvious to everyone, even at young ages. But the things that aren't are the taking care of your body part, making sure your nutrition is spot on, making sure that your recovery is spot on, making sure you're not overtraining. And if you're starting to get injured, taking appropriate precautions, thinking about things like sleep, thinking about things like toxins you're putting in your body, whether that's alcohol or whatever that may impair your performance, right? So the younger the age, you can start talking about those things and helping them see things like the food that you put in your body is fuel that will help you perform your best as an athlete. So I have daughters who are going into 6th and 8th grade. And as we go to practice, the concept is, hey, make sure you eat the right thing before practice to give you the energy to get through. And after practice, make sure you eat the right things to help you recover, right? And it's just, doesn't have to be complex, but it just has to get their mind rolling in that direction. That way, as their skill set improves and as their strength and speed and physique and all these things start to become appropriate for their sport as they develop, they're already working on those. And that they don't show up for high school, college, professional level with a very low level of knowledge and with a whole bunch of bad habits and a whole bunch of injuries and other wear and tear that have accumulated along the way.
Can you take us through, just say one of our athletes, they go to you.
Yes.
It's day one. They walk into your office, they sit down, and we're all the same. What the fuck do we do? What do we say to you? Can you take us through that journey of like, okay, I got a new athlete or a new person onboarding. How do you approach it?
Well, I think the first thing that I like to do is to get to know each other a little bit. If they have that fear or that concern or that nervousness, that it's inevitable for anyone when they're doing something new, to just get to know each other a little bit, to show each other that we're just normal people just talking, right? So I want to know a little bit about their background, right? Like what sport they're playing, where they're from, where they grew up, things like that, just what they like to do, that type of stuff, and establish a little bit of a rapport and kind of get to know each other. Tell them a little bit about myself. And then I usually like to start with, what are your goals? And what are the impediments you're feeling or experiencing right now that are getting in the way of your goals? And from there, it's just a conversation. I don't always have it scripted. I usually don't. It's just let it flow. Just like you're talking to a friend, that just telling you about themselves. And then, I kind of make notes of what they said here and there, and then kind of come back and explore each option. And then we can sit down and hopefully design a plan to whatever issues they're having now to get those resolved, but also point them in the right direction of where they want to go and make sure they're thinking about all aspects of their health and wellness, outside of the things that they're probably focused on. And that includes mental aspect to things and everything else, and once we just got to know each other and understand that, then we can create that plan, put it in action, and stay in, close communication. I really think, for an athlete, being a physician for an athlete, or really a physician for anyone, communication is key,
Mhm.
right? And the ability to communicate without time pressure and time appropriately. Athletes have things move at a little faster pace for them.
Mhm.
If an athlete is performing or training and they have an acute injury, it's not something like a regular person where you can say, we'll get to that in 3 days or we'll get to that next week, right?
Mhm.
We need to get on that right away. And that's why they need to have the ability to call me or text me or email me. And it might be on the weekend or it might be at night and say, hey, this is what's going on. They may not even be in the same city, right? And
Yeah.
we can start to formulate a plan to understand what they're going through, understand the magnitude of what they're going through, and most importantly, start to get a plan together to resolve that issue so they can get back to doing what they're doing, right? And just observationally, what I see for most athletes, the biggest impediment to success is the injury, right? You're making steady progress, you're acquiring skills, you're getting faster, stronger, better, whatever it is your sport requires to be good, and then you sustain some kind of an injury or a setback that takes you way back. And then it takes a certain amount of time to get back to where you were. And then you hope to progress to the next level, right? If we can just prevent that from happening, or we can minimize the downtime when it does happen, then I feel like it gives the athlete a much better chance for success.
How much time do you initially spend with a person via a consult with you?
Honestly, as much time as it takes, right? I don't have a set time limit. And I don't think anyone who ever comes and sees me is going to see me look at my clock and say, hey, Tom, I'm sorry we're out of time, man. I know we're just getting to the meat of it, right? On average, I'll block out anywhere from 60 to 90 minutes. Sometimes we get the conversation done in 20 or 30, depending on what the athlete needs and what their agenda is, right? And sometimes it takes more than that. And sometimes it might take a follow-up conversation later that day or the next day or whenever. So, but mostly I would say budget about an hour or so for that initial conversation. And then oftentimes I like to do some specific testing that gives me more information about what's going on with them that we can then better formulate a plan. And that series of testing might take 2 to 4 hours. So it's usually the format is meet, get to know each other, figure out if there's anything we need to do to assess them, labs, other testing, run those tests, get the results, sit down and say, this is what we found. And let's make a goal for these things. And it might be something like, hey, how much lean muscle mass do I have? How much fat mass do I have, right? Getting that DEXA and seeing that and then saying, okay, here's where we are. Where to perform optimally for your sport and your position should we be, right? And then we can write that down. Or it might be a VO2 max. Where does my VO2 max need to be to perform optimally? Something like that. So, once you identify those type of things, you can make a plan to get there and measure it every so often along the way to make sure we get the end result.
I'd like to talk about the team you've assembled. And this comes back into the plan you're talking about. When someone comes in, they consult with you, they go through a series of objective tests.
Sure.
And you have people who are experts in different fields executing these tests and putting this pretty robust booklet of information together. Where did this process come about? And can you explain further why you have the people in your clinic that do what they do?
Absolutely. Well, it sort of starts with what I was saying about physicians, how a lot of physicians don't necessarily have the training or the understanding of what it takes, and the unique things that athletes experience. And that's the same thing for other disciplines too. There's, physical therapists and dietitians and so on and so forth. And you might be a really, really good physical therapist per se, but if your client and your list and your base list is older people who are having a joint replacement, you might be really, really good at that. But when an athlete's acutely injured, you may not be the best, So what I did when I was looking at this and I realized, oh gosh, I need a subset of talented individuals in a certain way, I realized that I had to go out recruiting. And I sort of looked at where this type of care is done at the best level, at the highest level. And if you just think about general healthcare, it's not connected. Physicians do their thing. The physical therapist they work with, they've never met,
Yep.
in a remote location. The dietitian they've never met, they don't have any access to strength trainers, right? They don't have any access to other things like that. So I took a model from high-end athletics, and it was mostly Division I college football, Ohio State to some extent, and NFL programs by talking to people who are either in that currently or have been in the past, right? And once I understood the framework of what the structure looks like, I decided to recreate that, to do my best to recreate it, right? So I started with hiring some really, really good strength coaches. So that's when I worked on Anthony Schlegel for a good year to come here. And I realized his experience with Ohio State football and being the head strength coach for the Jacksonville Jaguars, that he had a tremendous amount of insights into basically strength training, speed training, recovery, especially, and also how a team like that integrates. So when I started to hire the rest of my staff, I specifically looked for people who have worked in an environment like that, so that they could bring their knowledge to our team and we could start to recreate that. What basically for every individual staff member, I looked for a diverse staff with different experiences coming from a different background, but we could come together as a team and apply this approach, like the approach you would see at a big time athletics facility, to anyone who walks in our door. And that might be a professional athlete, Westside Barbell athlete, or our parents, our kids, our colleagues, right? Our spouses. It doesn't matter. It's the same team that's there for you. But yeah, that's kind of how we got to where we are with the team that we do have.
What are the battery of tests you do, and why do you do them?
So when I sit back and look at, let's call it human performance in general, I think some of the things that allow us to be healthy and to perform well, whether we're an elite athlete or whether we are a normal person, is the basics, right? It's nutrition, it's body composition, it's cardiovascular fitness, it's mobility, and those type of things. So really what I want to know when someone comes in is, what does your metabolic health look like? What does your lab profile look like? What physical restrictions are you having as far as injuries, mobility, things like that? So, most of the assessments we do are as designed to assess that. So one of the things I like to start with is the nutrition aspect, and I like to know what a resting metabolic rate is on that person. And once I know that, we can calculate what their total energy expenditure is, and that helps us figure out what kind of nutrition they need to perform, no matter what their goal is, right? I like to use the DEXA because I need to know body composition, and I need to know, most importantly, metabolically and for overall health is perhaps the visceral body fat. If you've excess visceral body fat, it's going to put you at risk for metabolic disorders like diabetes, high blood pressure, cholesterol abnormalities, heart attack, and strokes, right? So I need to see where that is, and I need to see how much lean muscle mass they have, and I need to see how much fat mass they have, and I need to see where it's distributed. I like to get the DEXA bone density so I know if there's any osteoporosis or osteopenia or things like that are building. I want to see a baseline EKG. I want pulmonary function tests. I want to make sure their lung mechanics are appropriate. I want to get that person on a treadmill or a bike, and I want to put them through an EKG stress test while I do a VO2 Max. I need to know what their cardiopulmonary status is, how robust that is. One, to make sure it's adequate for good health, but also if you're playing the sport, we need to make sure it's appropriate for the sport you're playing. I like certain baseline lab values, the things that any doctor would check, your blood counts and your electrolytes and your kidney and your liver function, and things that show nutritional status and thyroid and cholesterol values. And I like to get tests to see whether you have any insulin resistance or not. And For most people, we check a vitamin D. We found that it's very low, and people live in Ohio, and athletes, it's shockingly low. It can make a big difference in performance. For a lot of people, we want to know their hormonal status too, whether that's testosterone, estradiol, and progesterone. And I think a lot of people forget that testosterone plays a very important role in the female athlete too. So I just like to combine that data. Now, the other part of the data that I need is an idea for the musculoskeletal system and how it's doing. And that's why most people, I like them to start by seeing one of our physical therapists. So, even if they're not having any problems, just to kind of get a good baseline assessment to identify things that could potentially be problems, right? Now, for a subset, I also like to have them do some of the VALD performance testing, so we can start to measure some of those things. Use their Nord board and the force deck, and use the force frame and the dynamo. So we just kind of get a good assessment for where they're at and imbalances and where an injury might occur, so we can start to get on top of those things before they happen.
There's a lot to dissect in that. One is, when you say metabolic health, what does that actually mean?
It's kind of a vague, like a broad term, and if you look at metabolism, to me, part of it is how a person processes calories, how many calories they burn a day, but also, is their thyroid function normal, right? Is their vitamin D metabolism normal? Are their sex hormones appropriate? Is there insulin resistance? All of those things that kind of, our system's really, really complex, and there's a lot of hormones involved, whether you're talking about cortisol or other things. And a lot of times those items can become out of whack because we've overtrained, or we haven't slept enough, or because we're chronically nutrient deficient, or our stress levels through the roof, or things like that. So they give signs of underlying issues that need addressed that can help an athlete or anyone perform better. Occasionally, you might find something pop up that isn't from training, but it was an underlying thing that, if undetected, would have hindered their performance as an athlete. And so I just like to kind of get a good all systems check. And once we have that, we can start to find things that maybe are suboptimal and optimize them. And some of it too is just a good way to sit with the athlete, show them this data, help them understand their bodies better, and start to think about ways to treat their bodies better so that it can perform at its highest level for as long as possible.
So you brought up DEXA scan. What is a DEXA scan, and why is it important?
It's really interesting. Through all my medical training, I had only thought of a DEXA scan for bone densities, for little old ladies who have osteoporosis that you need to start checking when they hit menopause, right? What I didn't realize is this tool is really cool. And basically it uses two different X-ray beams, and it can scan your body from head to toe. And for a body composition, it can break down those tissues into densities. And it really breaks your tissue down into 3 densities by region. One of the densities is things that are water density, roughly. And those are the things that are lean mass. Then you have things that are less dense than water, what would float in a swimming pool, and that's fat, right? And then things that are more dense than water, and those are typically bone, or if you've had some kind of an operation, you have an artificial hip, that will be more dense, that will show up in that category too. So when you look at the lean mass portion, a certain percentage of that is going to be muscle tissue, right? The other is going to be organs, your heart, your liver, your skin, your blood, and so on and so forth. But as it goes through your body, it starts at your head, and it works its way down, and it does these little cross sections, and it figures out the volume of that cross section and the densities of different segments within that cross section. And then it adds all up, and it gives you a nice little report that says, hey, my left arm has X number of pounds of bone and muscle and fat, and my right arm has this, right? And it does the same for basically your trunk, which is your chest and back, and it does it for your abdominal area, which is also the area where you measure that visceral fat, and it'll do it for the gynoid area, which is assessment more like your glutes and hips, right? And then it'll do it by legs. So you can kind of look at that and get an idea for what's going on, and for an athlete, sometimes you see some really interesting data points. Ideally, both of your arms and both of your legs should have the same composition, right? They should weigh the same and have the same amount of muscle, fat, and bone. Well, you sometimes see dramatic differences. Like, for example, I saw a Major League Baseball pitcher who had 4 pounds more lean mass in his pitching arm than his non-pitching arm, right? 4 pounds is a lot, and kind of made sense, and he spent that summer trying to build up his left arm, and he did a pretty good job closing that gap, right? Oftentimes I will see an NFL punter, for example, who has more lean mass on their plant leg than their swing leg, and it makes sense. That's how they've been using it. But if we need to balance those out to decrease the chances of injury in that athlete, right? And you combine that with, say, like a Nordboard test that tells you the functional strength in there, and now you're making progress. So that's essentially what a DEXA body composition is. You also see an injury, like you might see a right leg dominant athlete who has less lean muscle mass in that right leg because they've had a knee injury or a hip injury that is, and they've been babying it and it's atrophied as a result. So now you can say, hey, okay, now as part of the plan, we got to get that robust, we got to build that up. So that's, one of the ways. The other part, you can look at this, and we have normative data by a wide variety of professional athletes and non-professional athletes that we can compare a person's body composition to that position in that sport. So I can pull the data that says an average NFL linebacker is this height, this weight, this body composition. Or we can do the same for a college softball player and so on and so forth, right? And I also have tremendous amount of data on pro bodybuilders at the time they compete at the Arnold Classic, right? So to some extent, let's say you have an athlete walk in the door, and this is something that I've experienced. I had a long snapper that I worked with that was a 4-year starter at a very prestigious, college football program, and they wanted to transition to the NFL. Well, they came out of college weighing 224. And they knew the NFL wouldn't look at them unless they weighed between 240 and 250. So we had 12 weeks from the end of the season until, they just show up at pro day and the combine or whatever that time frame was. And we got a DEXA. We made a nutritional plan. We made a training plan. We DEXA'd them every month. And on the day of the pro day came, they weighed 242. And they actually had a lower body fat percentage than they did when they were, whatever it was, 224. So, that's one way that you can use that data. Or, you can say, hey, I am a swimmer, right? A NCAA swimmer. And I realize that if I have a little bit less fat mass, I'll have less to drag through the water. So if I can keep my muscle mass the same or make it a little bit bigger while decreasing that unwanted load, then I might perform better. So it's just one other tool to help someone achieve what they're trying to achieve. And
it's still the gold standard, right, for body composition?
I haven't found anything as good.
Because we used to do hydrostatic weighing, which was very intrusive to where you have to plunge into that pool and come back out. But for this, you just lie on a table and just don't move.
You lie on a table and don't move, and it's either going to be somewhere between 7 minutes and 12 minutes, depending on how big you are, right? And hydrostatic, I think, is extremely accurate, but all you get is a total number.
Yeah.
You don't know where it's sitting. Bod pods are nice too. They're pretty accurate. They're a little more technically difficult to perform consistently, but same thing, you get a total number. You don't get a breakdown by region.
Yeah.
So that's the beauty of it. You can check that frequently. It's quick to do, and it gives you really accurate, reproducible results. And one of the things we've found is if an athlete wants to make a body composition change, that after about 4 weeks, the DEXA will show that.
Yeah.
So when you then say, I'm going to change my nutrition plan in this way, or I'm going to change my training program in this way with a goal of accomplishing this. Well, after a month, you compare the start data to the end data, and you said, did this plan do what I wanted it to do? And if it did, great. we'll bump fists, high five, and we'll go repeat until we get to the end goal, right? If not, we can say, what went wrong here? Let's not just keep doing this thing that's not working. Let's change a variable. Let's maybe we didn't tell you the right nutrition. Maybe we didn't give you the best training plan, or maybe you didn't do what you're supposed to, But anyway, it gives us a chance to talk and say, hey, like things did not progress the way you needed to. Let's make a change. So
why is VO2 max important?
Well, I think, I'm going to start with the average person, right? Like the non-athlete or who has a goal. VO2 max is one of the best predictors for longevity. It's one of the best predictors of whether someone's going to have a cardiovascular event, right? So if you can take a regular person and say, hey, like we know your VO2 max is at this level, and if you can get it to this level, you will drop your risk of adverse health events significantly. Well, that's motivating. And it's something tangible.
How does it predict?
Well, basically, people who have low VO2 maxes have very low cardiovascular output, probably because they haven't been exercising and they haven't developed that system to its full potential. So because you haven't been treating your heart and lungs the way they need to be treated in order to perform optimally, you give them a higher chance of breaking.
And I'm going to play just like a devil's advocate so people don't know what we're talking about, but what does VO2 max actually measure?
Fair enough, right?
Yeah.
Essentially what a VO2 is the amount of oxygen your heart and lungs can deliver to your tissues at any point in time. So as you and I are sitting here, we need a certain amount of oxygen to perform our functions, our metabolic functions as we sit here. It's a low number, right? Mm-hmm. It might be 6 or 8 or something like that in order to do what we're doing. As we increase our workload, our tissues need more oxygen to sustain that activity. And as we progressively push it, one of the rate limiting factors on how hard we can go, right? How fast we can go is when we hit the state where our heart and lungs can't produce enough oxygen to give our body tissues what they need to perform at that level. And once that happens, you go into anaerobic metabolism. And when you're in that anaerobic state, because you don't have enough oxygen, you basically start to produce a bunch of metabolic waste products. Maybe the one we most commonly think of as lactic acid. Mm-hmm. It's not the only one. But those metabolic waste products make those cells able to fire and to function. So when you talk about like hitting a wall, and maybe the easiest place to visualize this is you're running something like a 400-meter dash, mm-hmm. And you're going faster. Well, once you hit that point where you've gone to your capacity and the metabolic waste products have built up, your cells can no longer fire. And that's why no matter what your will is, no matter what your desire, what your pain threshold is, your body fails you, right? So that's what we're trying to figure out where that level is, mm-hmm. right? Now, the thought being, if we can increase that VO2, the VO2 max is the maximum amount of oxygen you can deliver, right? And if we can bump that up to a higher level through very specific targeted cardiovascular training, then you can perform at a higher level. So that might mean you can run a few tenths of a mile an hour faster, mm-hmm. or, if you're a mixed martial artist or you're a wrestler, maybe when you're in that third period, or that extended period, you have the reserves to go a little bit longer and a little bit harder than your opponent, which gives you that competitive advantage. So,
and the other part you talked about is the VOLD aspect. So we went from DEXA for body compositions, looking at physical asymmetries, to VO2 max. The higher the score, the better. The lower the score, the worse. And I'm going to assume that affects quality of life. If you have a low VO2 max, you probably day-to-day tasks are not going to be that simple.
And it's been shocking to me to some extent, right? But it's also eye-opening. I've had some patients that come in, and you maybe have seen people around, and they probably weigh more than they should. But walking, say, from the couch in your waiting room to your exam room, which is maybe 50 feet away, they're winded. right? They're out of breath, like as if an athlete had just finished an event, and you're like, whoa. Well, then you go measure that person's VO2 max, and it's a really low number. Maybe it's 12, maybe it's 14. And you start to say, wow, if we can bump that up, you can do more stuff, you know?
Yeah.
So that's, it's, to me, having an adequate VO2 max is very much important in quality of life. And, you know, just to take a slight step back, when we talk about the DEXA and lean muscle mass that a person has, if you look at the data, the number one predictor for an older person being admitted to a nursing home is lack of lean muscle mass. You know, once that lean muscle mass is below a certain threshold in an older person, they can no longer stand up out of a chair. You can't get off the toilet seat. You can't go up over a step. And you don't have much extra. You know, when you basically it makes it very easy for you to fall. And once you fall, then you're in a nursing home because you break something and you can't take care of yourself, right? So some of these predictors are you just need a certain adequate amount to perform the activities of daily life and not get sick, right? Yep. But they also apply to the elite athlete, right? So,
Then VOLD, you're looking at isometric strength. So you can compare the actual strength to the DEXA scan for the asymmetries.
Correct.
So you have all the subjective data for this athlete. Have you ever experienced a disconnect from the verbal of what the athlete says they are to the objective data you got from them?
Quite frequently, right? I feel like athletes are more in touch with themselves, especially once they get to an elite level, right? Usually once they get to that elite level, they're all in and they're doing everything to the best of their ability, right? Now, sometimes there's still a cognitive disconnect between the way we perceive ourselves and the actuality. Now that distance between the perceived and the actual, I tends to grow more as a lower athlete level and into the general population. Yeah. But yeah, very often there is, you know, this is like someone may say, I have this goal. I want to accomplish this. I want to be a starter for my team, or I want to make the professional level for this, or I want to be on the Olympic team. And you collect that data and it's just not quite in line with where it needs to be. And then you start to go back to how are you training? How are you eating? How are you recovering? And oftentimes they're not doing what they need to be doing. And that's a way to kind of dial that in and say, hey, like, if that's your goal, you're going to have to step it up a notch if you really want to accomplish that. And this is objective data to back that up.
We've seen it subjectively. We have professional athletes who come in here, but nothing about them is professional. And I think a big part of it is if you want to become a professional athlete, a easy way to like kind of feel or get what it feels like is to live your life professionally. And that means your diet, your health, everything has to be on point.
You're right.
And from our side of the fence, training is pretty objective. Like the weights don't lie and it's easy to track and we track volume. Internally, it's a lot harder for us. But with tools you guys have given us, it makes our job a lot easier and effective. And it also allows us to show people like you have vast room to maneuver in this. Yeah. And there's a topic I want to bring up because a lot of the athletes we work with have to work within guidelines of USADA and WADA and drug testing. And I think a big fallacy is that you need to be on some sort of performance enhancer. But what we've found is usually athletes have to go down that road when they don't have objective information and they've got bad training. So how do you work with athletes who are like, okay, my testosterone level is in the gutter, but I can't take testosterone.
Sure.
I can't. How do you navigate that aspect?
Well, I think that's really a big topic overall and extremely interesting, right? Now the testosterone question is if you look at, say, a high-level athlete who's in their 20s and 30s and performing at a high level, they should have an adequate and a robust testosterone level just based on what they're doing, unless they're not taking care of their body the way they should, right? If they're chronically under eating, if they're not getting the sleep they need, right? If maybe they're boozing on the weekends or whatever. Those are things that will knock their testosterone level down, their own intrinsic testosterone level down. And because they're not allowed to supplement it or, for their sport, then their option is you have to improve those things that are causing it to go low. And as you improve those, you can follow up with testosterone levels and see them creep back in, because it's really hard to compete at the highest level, male or female, if your testosterone level is that of a 80-year-old person and your gender. So that's something that's really important. But what you touched on earlier is athletes thinking they need to take performance enhancing, agents in order to compete at the highest level. I don't think that's true. I think what I see a lot is sometimes it's an educational issue, right? They don't understand things, right? It's they want to compete hard and they think the only way to achieve that is with taking a substance. I see this a lot in the 22-year-old male average gym goer, and there's so much, I think the real performance to be gained is based on consistently optimizing those other factors, your training, your nutrition, your recovery, all of those things that lead to the highest end performance. You can't, half-ass your diet, and you can't not sleep, and you can't go to practice and not give it your all and think I'm going to take a substance and be the best of the best. It just doesn't work that way. That's not how it works.
I'm all for the athletes to work within the rule set. So if you're in a sport where you don't get tested, once you do it safe, responsibly, go for it. But what I don't like is when we have athletes who are consistently tested and you have those from the peanuts gallery looking down, well, they have to be on something, or that there's no way you can get to that level.
That's not
true. But when you start working with these and actually talking to these people, they're so freaking dedicated and they consistently don't miss.
Yeah.
And what I've found just anecdotally, and hopefully you can speak more on it, the biggest difference between all these athletes is those who take sleep seriously.
Yes, absolutely.
That seems to me to be one of the biggest performance enhancers for all these people who they figure out how much sleep they need and they do not forgo on it.
I couldn't agree more. We know that the average human being needs a certain amount of sleep per night, 6, 7, 8 hours, whatever it is, right? Now, all of a sudden, you put the stressors of being an elite athlete and the amount of training they do and the wear and tear on their body, they're going to need more, significantly more. So I don't know how an athlete who's going to spend 6 or 8 hours a day training thinks they can get by on 4 hours of sleep. You're just not. You will either hamper your physical improvements. You will not even come close to reaching your ceiling, but you're going to get injured. It's only a matter of time, right? The two biggest things that I see with injuries that are preventable are not taking care of yourself, either inadequate calories chronically or inadequate sleep chronically. Those are the two things that your body eventually breaks, and it usually breaks in the way of an injury.
What are ways of effective communication with doctors? So if someone comes in and they want to get the most out of their visit, what are some tips you can have for people when they come in and see their doctor?
Well, I think that to some extent, there's a certain amount of background information that the provider needs, right? Like there are things like that any physician is going to ask any patient, stuff like family medical history. What medicines are you taking? What surgeries have you had? What drugs are you allergic to? Those kind of things like that, right? So if someone comes with that information in advance and well organized, that speeds the process up, right? But I think the other thing is if they've just taken a second to organize their thoughts as to what am I hoping to get out of this encounter, right? Like what are their goals with this interaction? And what are the things that are preventing them for reaching their goals as a human being or as an athlete, right? And if that's clear in their mind, then that's a really good starting place where we can have a really efficient conversation. I think the other thing that's important is just honesty, right? Like it's hard to help someone if they don't tell you the truth, right? It's hard to help someone if they say, hey, I've actually been taking this performance enhancing drug, or I'm kind of embarrassed to say this, but I drink a 12-pack of beer every night, right? Like, if that data's out there, it's not a source of judgment.
Yeah.
It's just, okay, well, that's something we're doing. Like, why are we doing it? And let's understand the risks that might be putting on your body's overall health, or how it may be impairing your goals, so that then we can just have an honest conversation about that.
You're really dealing with behavior to where, like, okay, what is the mechanism that's causing this behavior, trying to adjust that more so.
It really is, right? Like, and that's the essence of the human condition to some extent. Whether it's you have a child at school who's acting out, right? Mm-hmm. Or you have an athlete who is doing something that's inconsistent with their goal, mm-hmm. right? Sometimes it's a lack of knowledge, right? Sometimes it's a fear. Sometimes it's another thing. But if you can understand where they're coming from, what their fears are, what their goals are, maybe what their insecurities are, and we can just lay that on the table and honestly discuss it, then we can begin to develop a close communicative relationship that over time deepens and allows us to be partners in that process.
When you're working with athletes who have rules and regulations to stay within, do you have them bring in that data, or do you stay away from it, or how does that work?
No, it's extremely helpful, right?
Yeah.
If, okay, I'm going to give you an example, right? There's a gentleman I know who's plays in the NFL currently, and he's maybe a 14-year veteran, right? So now he's getting a little bit older, and he's got diabetes, right? And his testosterone levels are really bad, right? Well, if we can sit down with the rule book and understand what you can and can't do, and a lot of those are asterisks, you can use it in this scenario, right? And you make sure that you do, because the last thing you want to do is have an athlete fail a test that limits their performance, and their ability to compete, because you didn't give them good advice, So we need that information so we can sit down and say, like, these are the rules. We are not going to, I'm not going to tell you to do something outside of those rules. I'm going to give you the right advice. But if we know what they are, then we can work within that framework to develop an optimal plan.
You bring up a good point, because we've talked a lot about emerging and athletes during, but you work with athletes on the other side of it who are coming out of professional sport.
Yeah.
And to me, this is a very underserved demographic.
Yeah.
In that you have grown up wanting to be a pro athlete. You've succeeded. You went through all the steps. You've been a pro. Now you've retired. Yeah. Now you're dealing most likely with a body that's going to start to betray you at some time. How do you deal with athletes who are on the retired level?
Well, that's actually a lot goes into that. And I do have quite a few patients that were once professional athletes, and now they're not, right? And I mean, I think it starts with the conversation starts with the mental aspect of it, right? You're used to have always been competing at the highest level and driving yourself, and to some extent defining yourself as an athlete, and having everyone come up and give you accolades, and all of a sudden that's gone, right? Like, who am I now? What's the next phase? How do I deal with the psychological implications of not having that anymore, right? So that's a really good starting point, right? But then you start to say, okay, now as the physical demands that you're putting on your body have changed, your, say, nutritional demands have changed, right? We need to think about those things. We need to start thinking about, you can't just not be physically active, right? We need to identify what injuries have followed you, what limitations have followed you, and start to optimize those, to the best of the ability. And usually you can, and then start to say, how do we continue to train in a level that's appropriate for what they want to do and just to be healthy. But I find a lot of athletes, once they're gone, they miss that brotherhood or sisterhood, They miss that competitive environment. So, and I find a lot of them, if they can channel that into a different activity or something different and still be surrounded by people with that mentality, then they can thrive. And sometimes those that don't become lost.
We've talked about a lot of stuff that you do with your patients and with athletes. And I know before meeting you and going through this, in the back of my head, I'm like, this is all well and good, but I'm not a pro athlete. I do not have millions of dollars to spend on such tests as DEXA scans and VO2 Maxes, going to the doctor for hour-long visits. This has to cost thousands of dollars. But with the Armory and the Shield, and this is not a product placement, this is because we all go through it. How can you afford to do this for, what is it, $200 a month?
Yeah, a monthly membership's $195, right? And essentially what you get with that is unlimited access to your physician. I'm one of the physicians in our practice, also our dietitian, our physical therapist. You've got all the recovery modalities. You've got multiple physical fitness facilities you can use. So here's how we can do it at that price point. When you look at the traditional insurance-based model that is based on volume and fee for service, this way I can formulate a overall budget and a budget per department. And as long as we have enough members to fill that budget, then everything's good.
Yeah.
So here's one of the things I think maybe the best thing about this model is when you see a provider, and by a provider, it doesn't mean necessarily physician. It could be your dietitian, your physical therapist, your exercise physiologist, whoever. At our practice, it's never about how many patients did you see or how much money did you generate. It's the productivity is, did you help the people who walked in your door? Did you give them the best level of care? So I think that was really important to think about, and if we go back to the physical therapy example, under the insurance model, they come in and they say, okay, you can only be seen for your left shoulder injury and you only have 12 visits and then you're out the door, right? When you come into our place, it's you spend as long as you need to get that healed. And it's not limited to one thing. It's you fix everything. So now that patient or athlete can transition out of physical therapy into life and strength and conditioning and that type of stuff. So it's actually a different mindset, both from how medicine's approached, but also for how it's paid for. But it actually works. The numbers work. So we're able to provide all those things at a price point that a lot of people can afford.
What's your goals?
My goals?
Yeah, with everything you're doing now.
Okay, so the big, hairy, audacious goal is to change the healthcare delivery model in our country. And that's the number one thing that drives me, right? Yeah. I became very dissatisfied for healthcare in this country. And it started with being unhappy myself and feeling like no matter how hard I worked, I wasn't providing good care and changing lives effectively. And then as you talk with other medical providers, almost across the board, everyone is unhappy with what they are doing. And then you start to talk to patients. And patients are in general dissatisfied with the care they're given. And then you start to look at the overall health of our country, and it's getting worse, not better, despite the fact that we have more and more technologies and we're throwing more and more money at it. And the problem is it's not designed to prevent, and it's not designed to fix the things that cause the problem. It's designed to put Band-Aids on the problem. And to me, I don't think that that's acceptable for our society. And I know there's a better system, and it's not going to change on its own. So my goal is to design a better system and then make it available to anyone who wants it. Not necessarily just in Central Ohio, eventually nationwide. So it starts with optimizing what that is, building the system, perfecting the system, and then, taking it, nationwide. But that's the big goal. The day-to-day goal is that anyone that walks into our doors and wants help, that we will do our absolute best for that person and give them the absolute best care and attention that they can get anywhere, and ultimately to change their life for the positive.
Mhm.
And that's really what motivates me. You know, each life that we can change and improve is a massive success. And at the end of the day, if that's how we measure our success as human beings, but also at the Armory, by the number of lives that we have positively impacted, then the mission will be a massive success. Whether that's for the average person, the really sick person, the person that starts out at 600 pounds, or the future U.S. Olympic gold medalist or Major League Baseball MVP. It's all the same. No one is more or less valued in our practice. No one will get a higher level of care and attention than anyone else. They all get our absolute best every time.
As we get ready to wrap this up, there's a few quick questions that I would like to leave on. One, if someone's listening now who is like, I got to go to the doctor next week, what are 3 questions that person should ask their doctor?
3 questions to ask their doctor. I think it depends on the goal, right? Is the goal I am sick, or is the goal I think I'm healthy? I just want to make sure not a problem popped up, right?
Let's just go, I think I'm healthy, going for a checkup.
Okay. So I think the first question would be, what are the standard data we need to collect in order to understand where I'm at for my state in life? Like, what should I be doing? You know, and that largely falls into what any primary care provider should be doing around the country, right? Am I up to date with my mammograms and my pap smears, and my colonoscopies and my prostate checks and my blood pressure checks, right? That's the starting baseline for the conversation. I think the next question is, what can I do better from a lifestyle standpoint? What bad behaviors do I need to change to give me the best chance for a healthy, active, fulfilling life, right? And then the third question is, when do we meet again? What's the follow-up, right? Because it's all well and good to get a really awesome plan, but if it's not fulfilled, then it's worthless, you know? So I think the next thing is to make sure after we give someone a plan that they have the resources to be accountable for that, so they can ultimately get to the end result, right? And that's the reason for the question, when do we meet again? So we can make sure we're following through on that.
We'll stick with the 3s. If you're an athlete, what are 3 things you can do or look at right now to improve your health and athleticism?
Well, I'm going to go back to the basics, right? And this also goes with the conversation that you brought up earlier, that we've seen some professional athletes that when you look at what they're doing, doesn't necessarily jive, you know, with stated goal, right? I think it's nutrition, and I think it's recovery are the top 2. And I would say the third thing is probably, and this kind of goes with recovery, but injury prevention. What am I most at risk for getting injured at in the short term, and how do I prevent that from happening? And I think those are probably the 3 things that they might think about the least, that they need to start thinking about.
Would that be where you go talk to a physical therapist to go like, okay, because a lot of athletes don't know what they're at risk of injury for?
Well, I think there's a couple different routes you can go with that, right? And I think typically we look at physical therapy as, I am injured, what do I do now?
Yeah.
But I think an even more useful approach to the physical therapist is, where I am most at risk for getting injured. Instead of being a rehabilitation plan, it's a prehabilitation plan. And I think there could be multiple professionals, depending on a person's state, that could be best assessing that. But I think a physical therapist is one of them that's very good. Also, if you have a really good strength coach, you know, that is very knowledgeable, especially in the return to play department, they could be extremely useful for that too. You know, I think it's also that testing, you know, the human testing with the VALD equipment, some other things too, are very useful at getting that information about, where am I going to get injured and how do I prevent it?
How many times a year do you think you should get testing done?
I think it depends on an individual, right? Like, by the demands they're putting on their body, but also their starting point, So, and that's always the hard question. How often should I see my doctor, right? Well, it depends what's going on in your life, right? Like if your blood pressure's out of control, it's going to be, you got to see him regularly until the problem's fixed, right? And then we got to keep an eye on it. If it's, I'm overall healthy and I did my full evaluation and everything is stone cold optimized and I'm not a professional athlete, it might be once a year, right? So that's very customized based on each individual.
Anything else you want to touch on?
I can't think of anything. I mean, I've had an absolute blast working with you, getting to know you and seeing what you guys do here at Westside Barbell. It's an elite team. It's one of the most amazing collections of individuals I've ever had the opportunity to work with. I also realized that my preconceived notion of what Westside Barbell is, it was completely off base, Yeah. And it's been really cool to see what you are doing, how elite it is, and how it's probably the best in the world at what you do. And for me to have that opportunity to partner with you on a long-term basis, I can tell you how excited I am.
It goes both ways. And said you and your team have made our onboarding of athletes and working with them hugely more effective because you give us a blueprint that's objective and in terms of injury mitigation, knowing where weaknesses specifically has made a huge impact. And I think from the athlete's perspective, knowing they have a place to go is very important, especially with those who are traveling and they need access to a doctor in 24 hours or less. So for that, I thank you. I thank your team. Thank you for coming. And then for everything else, see you guys later.
Appreciate the opportunity to be here. Really enjoyed myself and hopefully we'll do it again soon.
For sure.